What's something people don't know about pregnancy discharge? I bet you didn't know that changes in vaginal discharge are one of the earliest signs of pregnancy. Your body is embarking on many incredible changes, preparing for your baby's arrival. One common change you might observe is a difference in your vaginal discharge. Please know that this is very common for many women during their pregnancy journey. It's often a completely normal and expected part of this special 9-month period. We are here to help you better understand what to expect regarding these changes. Our goal is to provide you with clear information, offering reassurance and peace of mind. Understanding your body is key to a confident pregnancy experience. You might naturally wonder why your vaginal discharge changes or seems to increase during this time. This phenomenon is largely due to significant hormonal shifts occurring within your body, especially the rise in estrogen levels. These hormones are absolutely vital for maintaining a healthy pregnancy and supporting your baby's development. Additionally, there is an increased blood flow to your entire pelvic region. This includes the cervix and the vaginal walls, which can stimulate more secretions. This entirely natural process actually helps to protect your birth canal from potential infections. Think of it as your body's intelligent way of keeping the environment clean and healthy for your growing baby. So, what does typical healthy pregnancy discharge generally look like? Most often you will find it to be thin in consistency and milky white or even clear in color. It might possess a very mild, slightly musky odor, or it could be completely odorless, which is also perfectly normal. This common type of pregnancy discharge is medically known as leukorrhea. You may observe that the amount of this discharge increases as your pregnancy progresses further along. Seeing this is usually a very good sign. It indicates that your body is functioning just as it should during this incredibly important and dynamic period of your life. While an increase in discharge is generally a normal aspect of pregnancy, it is always wise to pay close attention to any significant or sudden changes you might notice. The color, the consistency, whether it's thin, thick, or clumpy, or the smell of the discharge can sometimes offer valuable clues about what is happening within your body. Understanding these potential variations can empower you significantly. It helps you to confidently know when things are perfectly fine and proceeding as expected. And importantly, it also helps you recognize when it might be a good idea to consult with your trusted doctor or midwife for further advice. I bet you didn't know how much the color of pregnancy discharge can reveal about your health. Let's begin by talking about white discharge during your pregnancy. Most often, a milky white or a creamy white discharge is completely normal leukorrhea, the type we discussed earlier as being very common. This is simply your body's natural and effective way of cleansing the vaginal area and maintaining a healthy environment. However, it's important to note that if this white discharge becomes unusually thick, appears clumpy, and starts to resemble cottage cheese in its texture, it might signal something different. If these changes are also accompanied by symptoms like itching, redness, or soreness in and around the vaginal area, this could potentially be a yeast infection, which your doctor can help treat. Now let's consider what yellow discharge might mean for you. A pale yellow or a light, creamy yellow discharge can sometimes be perfectly normal and nothing to worry about. This might occur if a small amount of urine unintentionally mixes with your usual discharge, or it could simply be a slight natural variation of leukorrhea for your individual body chemistry. However, if the yellow color becomes noticeably brighter, significantly darker, or takes on a distinct greenish tint, it becomes more of a concern, especially if this discharge is accompanied by a foul or fishy odor, or if it appears frothy in texture. It could indicate an infection such as bacterial vaginosis or trichomoniasis, both of which require medical attention. Observing green discharge at any point during your pregnancy is a clear and important signal to consult your healthcare provider without delay. Green-colored discharge, which might also present as frothy or be accompanied by an unpleasant or strong smell, is almost always an indication of an underlying infection. Common culprits for green discharge can include trichomoniasis, which is a sexually transmitted infection, or other various types of vaginal infections that can occur. It is very important not to ignore green discharge or hope it will resolve on its own. Getting it checked out promptly ensures that both you and your precious baby remain healthy and safe throughout the pregnancy. And what should you think if you notice brown discharge? Brown-colored discharge typically means there is a small amount of old blood mixed in with your usual secretions. Very early in pregnancy, this could potentially be implantation bleeding, which occurs when the fertilized egg successfully attaches itself to the uterine lining, a normal early sign. It can also sometimes occur after sexual intercourse or following a pelvic examination performed by your doctor, primarily due to the increased sensitivity and blood flow to your cervix during pregnancy. While occasional light brown spotting can be harmless, particularly if it's not ongoing or heavy, any persistent brown discharge or a noticeable increase in amount should always be discussed with your doctor to rule out any potential complications. You need to watch this if you struggle with understanding pregnancy discharge. Pink discharge during pregnancy can indicate a small amount of fresh blood. This can happen after sex or a cervical exam due to increased blood flow. In late pregnancy, pink discharge might signal early labor. Report any new or persistent pink spotting to your doctor. Heavy, watery, or foul-smelling discharge needs medical attention. Bright red bleeding or severe pain requires urgent care. Always seek medical advice if you're unsure. Your healthcare providers are there to support you. Trust your instincts and reach out if something feels off. What's something people don't know about maintaining a healthy pregnancy? Let's dive into some essential tips. Maintaining healthy habits during pregnancy is crucial. Your body is performing an incredible feat by nurturing new life. It's natural to notice changes, including in your vaginal discharge. Understanding these changes can bring comfort and reduce anxiety. Most changes are normal and part of the pregnancy experience. If issues arise, they are often treatable with your doctor's help. Focus on the wonder of this journey. You're doing an amazing job. Simple hygiene habits can promote good vaginal health. Wear breathable cotton underwear to avoid infections. Avoid douching to maintain a healthy balance of bacteria. Wipe from front to back to prevent bacteria transfer. Keep the external vaginal area clean and dry. Communicate regularly with your healthcare provider. They are your trusted partners throughout this journey. Attend all prenatal checkups for continuous monitoring. Trust your body's wisdom and your instincts. Embrace the joy and excitement of expecting your baby. Cherish this special time and stay connected with your support system. Your healthcare team is here to help you every step of the way. Share your experiences in the comments and subscribe for more content.